Alright, so in the last video we talked about plasma, and we said that plasma is the liquid part of blood and that it constitutes of 92% of water, then 8% solids. And under the solids we say that we have proteins, we have coagulants, we have electrolytes, hormones, and so on. So under the proteins we see that there are mechanisms which can lead to their decreased number in the plasma. So firstly, one might think that when one fasts of food or is on a strict diet, right, one might decrease their level of protein concentration in plasma, but that's not the case, since blood proteins are maintained during starvation and are only depleted under severe starvation, right? That's the first point to note. Then the second point to note, a condition that is quite striking is malabsorption, where the intestines find it hard to absorb the proteins from the diet, that is the exogenous products. This may also lead to low plasma protein concentrations. Then we have liver disease, right, and renal insufficiency. So we all know that in the liver, that's where most of the plasma proteins that are found circulating in plasma are produced, right? The same as in kidneys. So when one has a disturbance in the kidney or in the liver, this may result in low plasma concentrations, right? So what are some of the examples of diseases with low plasma protein concentration? So the first one I have here is thrombotic thrombocytopenic purpura, which is a type of hemolytic anemia where we have red blood cell destruction, and this will manifest as fevers, and also we have renal dysfunction, right? That is, we have the inability of the kidney to produce these plasma proteins, and this plasma of necessity is ADAMTS13. That is the cause of this thrombocytopenic purpura, right, or its inhibition. We see that this ADAMTS13, it works to break down big Van Willebrand factors, right? So when it's absent, we see that the amount of platelets which are bound to Van Willebrand factors increases, right? And this leads to thrombosis, and this thrombosis, it will lead to a low plasma concentration within the blood, since most of it will be bound to Van Willebrand factors, right? So this will lead firstly to thrombosis, right? And since there will be multiple thrombuses flowing in the blood, these thrombuses can lead to stroke and unnecessary clogs in blood vessels, which can lead to high blood pressure. We also see that since there are low platelets now circulating in the blood, which are unbound to Van Willebrand factors, there will be a condition called hematomas, where the blood vessels are unable to keep the blood within the blood vessels, and this leads to an internal hemorrhaging, right? And this can be seen as blotches, purplish blotches throughout the skin, right? So we see that plasma proteins are of high necessity. Also, clotting disorders are some of the examples of these diseases. As we said in the last video, we have hemophilia. So when one has a deficiency of factor 8, they will have hemophilia A, and when one has deficiency of factor 9, they will have hemophilia B. And the symptoms involved are hemothrosis, that is bleeding in joints, and hematomas, that is collection of blood outside of blood vessels. As we can see here, there will be inability to form a proper clot. So when one bleeds, they will bleed excessively, right? And also take note that hemophilia is a hereditary disease. It's passed on genetically. Then we also have immunodeficiency, the example here being Bruton disease, where there is failure to produce immunoglobulins or antibodies. So how is this pre-B cells, right, they will fail to mature into plasma cells, which then produce antibodies. So again, we see that plasma proteins are necessary. We all know that antibodies are a defense mechanism which we have, and they act as markers for tagging pathogens. So we see that having low plasma proteins is not good in the blood. Then finally we have edema, where there is decreased plasma oncotic pressure, right? Since the plasma proteins which we have in normal cases reuptaken the fluid in tissue fluid, right, or in the interstitial spaces, would be absent. This will lead to swelling caused by an excessive amount of fluid in peripheral tissue. So again, we see that plasma protein are of high necessity, and one should always make sure that their plasma protein levels are on spot, and if they are not, should consult a physician. So that's all on this lecture. In the next lecture we shall talk about red blood cells. So thank you.